Good evening, everyone. Good evening. Good evening, Miss Jenica.
Hello, good evening.
Okay, so I believe since it's already 8 p.m., we can now start our session for tonight. Okay, so to everyone, welcome to our live webinar on Healthcare Assistant Program to Canada. So for this one, I will be your speaker for tonight. Of course, with me is Miss Jenica Licerio, our representative from Stenberg College, and me as a client acquisition manager of Roman and Associates Immigration Services. I will be discussing with you the immigration process on how you can secure your necessary visa to Canada. Of course, Ms. Jenica will be discussing the complete program details and the process on how you will be able to enroll for the said program. Before we start the session proper or the Healthcare Assistant Program webinar, just some few reminders to everybody that as we start speaking and discussing, I will be putting everyone in mute, and later on we will be having our Q&A session. So should you have questions or clarifications during the discussion, you may temporarily post them to our chat box. Then we will address those questions one by one as we finish with our discussion. Okay, so to begin with, well, again, welcome to our live webinar on Healthcare Assistant Program to Canada. This is, of course, in facilitation of Roman and Associates Immigration Services in partnership with Stenberg College. Okay, to begin with, let me introduce to you our company. Roman and Associates Immigration Services Limited is a registered Canadian immigration firm in British Columbia, Canada. And so we are registered in Canada Business Registry. Where are we located? We have our two offices. We have one in Canada. This is in Nanaimo, British Columbia, and the one in the Philippines, it is in President J.P. Laurel Highway, Lipa City, Batangas. And for those applicants coming from North or probably within NCR, we also have our extension office in Kalumpit, Bulacan. So we would love to see you there. Just message us on your schedule and when you want to visit our office. Okay. Of course, what makes us different from other organizations offering the same services? We have our own licensed immigration consultant. And at this very moment, I want to present to you Mr. Israel Roman. He is our licensed immigration consultant. And of course, he is registered with the Immigration Consultant of Canada Regulatory Council. His license number is R524540. Should you want to counter check if he is an active licensed immigration consultant, you may do so. So you'll get confident that you are really dealing with legitimate organization and a legitimate person. Okay. Some facts about our licensed immigration consultant is that Mr. Israel Roman, of course, here in the Philippines, he is a registered nurse. And also in Canada, he is an active registered nurse. And he is working as nurse manager in British Columbia. So with one of the biggest hospital within British Columbia, he's working as nurse manager. And way back 2008, that's the time when he decided to migrate to Canada. But prior to that one, he used to work as nursing professor with one of the biggest universities here in the Philippines. So there you go, our licensed immigration consultant. Don't forget, we have our very own Mr. Israel Roman. Okay, the very question for this session or webinar is that for us to answer your question, how are you going to work as healthcare assistant in Canada? Okay, in a regular means or regular process, for you to be able to work as healthcare assistant in Canada, you need to apply for registration with Health Worker Registry. You also need to be registered in BC Care Aide, of course, with Community Health Worker Registry as well. But the requirement for this one, for you to be able to undergo or to perform all these steps, is that you must be residing in Canada. So what then? What if you are not residing in Canada? What's in it for you? How are you going to work as healthcare assistant in Canada? For internationally educated healthcare professionals or graduates of healthcare assistant program outside Canada, you may simply apply for study permit and take the healthcare assistant course with Stenberg College. So Stenberg, of course, is our partner school for this course. And we will have later a discussion about the full details of this course. So for applicants outside Canada, you simply need to apply for study permit and take the healthcare assistant course should you want to work as healthcare assistant in Canada. Okay, so how are you going to do that one? Of course, here is the, what do we call, the magic formula for that specific process. You simply need to talk to us. You simply need to approach Roman and Associates Immigration Services, of course, plus Stanford College. We will definitely give you the answer to your questions on how you will be able to migrate successfully to Canada by means of your study pathway. Again, don't forget the formula flashed on your screen. It is Roman and Associates Immigration Services, plus, of course, with the assistance of Stanford College. This will give you your passport towards achieving your dream and living a life in Canada. Okay? So that's how easy it is for you to be able to work as healthcare assistant in Canada. Okay, let's say, for example, you successfully finish the specific course, which is the healthcare assistant program. What awaits for you? Okay, so flash on your screen, these are the things that may probably happen, or that which these are the things which you can probably expect should you finish successfully the healthcare assistant program by means of course, taking the student pathway to Canada. After finishing the course, of course, you would really desire to land in a position or to land in a job that would definitely give you the work permit. Okay, if you already have your employer, of course, it will be easy for you to really apply for work permit. So that's necessary. And if should you want to really work legally in Canada, you must be possessing that work permit document. Okay, so next, after 2 years of working, you may now apply for permanent residency visa. Under caregiver pathway, or should you want to continue on the study program, you may just take postgraduate diploma in Canadian nursing or early childhood education. So these are the steps which you can take as soon as you finish studying healthcare assistant program to Canada. First, you can, of course, you need to secure your work permit if you already have your sponsor employer. Second, after 2 years of working, you are now eligible to apply for permanent residency visa. Or you may probably continue your study by taking the postgraduate diploma in Canadian nursing, or on the other side, you may take early childhood education. So those are the things that we should remember after successfully finishing the course. Okay. One thing that we are considering if we are to, apply or process our papers going to Canada and taking the course healthcare assistant programs, that on the side, how much will you be earning as a healthcare assistant in Canada? Is there really job waiting for you in Canada should you finish the course? Okay, so flash on your screen, this is just an example on how you will be able to check how many jobs are available in a given location in Canada. So for this one, if you are to check the healthcare aid in British Columbia, this will give you this site. So it is indicated here, the location, the number of available jobs, and should you want to check the details of the vacancies, you may just proceed to the view job posting. So let's say, for example, in British Columbia, for healthcare assistant positions, there are like 117 available jobs. In Lower Mainland's Southwest region, there are 53 jobs. So this simply manifests that after finishing your course, there would really be available jobs for you. So you don't have to worry if there will be an employer who will, probably give you the sponsorship to process your working permit. Okay. Next, of course, our concern, as you apply for a job, you will be, interested to know how much will you be earning if in case that you will get hired for a specific position like healthcare assistant in Canada. This is also one way of checking how much you will be earning depending on the location or community area where your employer is located. For example, in British Columbia, we have three categories for the wages per hour rate. So we have the low, the median, and the high. Low, median, high, these are the categories depending on where your employer belongs in terms of their financial capacity to pay towards their employee. So in British Columbia, the low wages per hour, dollar per hour, is 18 Canadian dollar per hour. So their median is 22, then their high category is 25 Canadian dollar per hour. So and so on and so forth. Should you want to check also specifically a specific location, you may just check and take a look at the table below. Then you just search what specific region are you checking. Then it will show you the low, the median, and the high Canadian dollar per hour salary range. Okay, so for this one, you be probably considering working long term or quite some time for the next 3 years or 5 years, being a healthcare assistant in Canada. So this is just an example how a good opportunity in Canada that even at least even if you finish the first contract of your employer, there are still jobs that will be available for you in the next 3 years. So this is just a mere example. For example, in Canada, the job prospects is categorized as good, so meaning there are really enough jobs for you for all the graduates of healthcare assistant program and so on with other courses that are medical related and with general studies. So that's how good the opportunity in Canada. You will never run out of opportunity to really land in your desired job. Again, you may probably check on a specific location, then how is their job prospect would be. Okay, so since you already know or you already have an idea on how to counter check the hourly rate for healthcare assistant in a given location in Canada, let us try to consider this one. So for this one specifically, the patient services aid under the 142368 code, the salary range hourly rate is already 25.83 Canadian dollar. So this is for the healthcare assistant program, and their salary range is 25.83 per hour. Let us now try to compute how much it's equivalent in Philippine peso, given that you are coming from the Philippines. Okay. Okay, so for this one, this is our sample wage computation for healthcare assistant program. On the previous slide, I have presented with you that the hourly rate is 25.83 Canadian dollar. So given that you are required to work 40 hours per week, that means after 1 week, you will be earning 1,033.20 Canadian dollar. And if you are to compute that one for the whole month, you will be earning 4,132.80. And if we are to compute, of course, for the whole year, you will be earning 53,726.40 Canadian dollars. Imagine how much it's equivalent if we are to consider 41 pesos as conversion rate for every Canadian dollar. Okay, 41 pesos, this is our updated conversion rate as of today, May 13, 2022, here in the Philippines. The 53,726.40, this is already equivalent to 2,202,782.40. Imagine, and just working For like for like 1 year, you will be earning this much. Here in the Philippines, admittedly, for you to be able to earn this one, you have to spend half of your life working as a regular employee, and probably this will already be your retirement pay. But in Canada, in just with just working like 1 year of your life, you will have the opportunity to earn as high as 2,202,782.40. That's how the opportunity for healthcare assistant in Canada. Okay, how about if we are to consider also the hourly rate for in-home caregiver? This is another way of getting into Canada and be working as caregiver for for private household in Canada. Okay, for this one, the hourly rate for in-home caregiver in Canada, the median rate is already in 16.85. Okay, of course, uh, the rates are also categorized per community area. So should you want to check that one, you may also visit the home health care worker in Canada, and you just simply need to go to the wages section. So it will give you this site and this view. So you just need to choose which specific area you want to check. But for this one, let's take into consideration the one in red. For Canada, it is 16.85. Now, let's try to compute that one given that you will be earning 16.85 Canadian dollar per hour as in-home caregiver. So again, you're asked to work 40 hours per week and you will be earning 674 Canadian dollars. For 1 month, you will be earning 2,696,000 Canadian dollar. And for the whole year, you will be earning 35,048 Canadian dollars. That simply means you will be earning 1,436,968 pesos with just working one whole year in Canada as in-home caregiver. So definitely, regardless if you're working as healthcare assistant or in-home caregiver, still the value is really um, exciting, and it will give you much motivation to really undergo the process necessary for you to successfully migrate to Canada and be working there for quite some time. Okay, so remember that for in-home caregiver, the median rate is 16.85. Then for the healthcare assistant, it's already in 25.86 Canadian dollar. Okay. So now that you have the idea already on how to check if there are really available jobs for you, how much you will be earning, if in case that you will, successfully migrate to Canada and be working as healthcare assistant program, what will be the advantages in joining with us? Of course, we are in partnership with a college that delivers exceptional education. We also have reasonable administration fee. Of course, we also have a reasonable retainer's fee, and you'll definitely get assured that you'll get job security. Okay. Again, should you want to migrate to Canada and work as healthcare assistant program, don't hesitate to talk to us, Roman and Associates Immigration Services. Of course, with the help of our partner school, Stenberg College, we will definitely help you achieve your dream of living a life in Canada. Okay, so that's all from me. The next step for this one is that, of course, we will be hearing Miss Jenica as she discussed with us the complete program details of the healthcare assistant program to Canada. And for this one, I just want to remind everybody that after this webinar, you may send your detailed resume for eligibility check to assessment at Roman CIS, and we will be assessing your eligibility for free. Don't forget to use the subject line assessment for HCA at Stenberg College. Okay, so that's all for me. Just hang in there. We still have Miss Jenica to discuss with us the program details. Then later on, we will be having our Q&A portion. Okay, so thank you so much, guys, for listening. Then I'll be.
Hello there, Rose. Good evening, everyone. Thank you so much for joining tonight's webinar. Let me just also try to share my screen. second. There you go. So I hope you can see my screen. I'm gonna start off with showing our introductory video at Stenberg College.
I can see.
All right, so there you go. That's Stenberg College. So good evening, everyone. My name is Jenica, and I am the Director of International Admissions and Recruitment for Southeast Asia and the Middle East. So I am based here in the Philippines, and together with me is Alexa Laksa, who's our International Education Advisor. So we work together closely with Roman and Associates in providing you information about, your options of what to study in Canada. So let me tell you about Stenberg College. So Stenberg College is a private post-secondary college, and we were founded back in 1990 by Mary Jane Stenberg. So our school really started as a medical college, and our specialty programs are in the nursing programs. So we were delivering programs for over 30 years now, and we were able to expand into other industries because of the success of our graduates. So we have programs under aside from healthcare, we have programs under education, business, and human services. But for tonight, we will only be focusing on the healthcare assistant. Now, if you check our website, if you go to www.stenbergcollege.com, what you'll see is there are a lot of other programs there. Okay, there's a lot of options. However, please click on the international tab. So you will be redirected to the international page, and there will be a limited number of programs for you. So we want to make sure that when we deliver a program for international students, that our students will have security when it comes to their employment, and it will have a permanent residency pathway. So the campus location is in Surrey. So if you're not aware yet, Surrey is actually a suburb of Vancouver. So we're just about 40-minute train ride away from Vancouver downtown. And the campus is situated in front of the Central SkyTrain station. So it's a very accessible location. There are a lot of amenities and establishments surrounding the area. And Surrey is actually the second largest city in British Columbia. Now, one of the things that we're very well known for would be our strong employer and industry relationship. So this is something that I'll be discussing with you later on. So once you become part of Stenberg College, we want to make sure that you're successful. So we have support and services for you. Now, when we talk about success at Stenberg, we're not just talking about you, passing your subjects, but also it includes being employed and being successful with that, and also the access to permanent residency, because some of you might pursue that afterwards, right? So we want to make sure that you have access to it. So at Stenberg College, you'll be supported by our student services. Okay, they will be the first group of people that you'll be encountering, because they will be providing you your orientation, and anything else that you need, you just go to student services and they will redirect you to the proper department. We also have academic support. So we always remind international student, it doesn't mean that you shouldn't study, because it is also still a big part of your international student journey, right? Studying. So we want to make sure that you pass your subjects. So we have academic support. You can do one-on-one sessions. You can have a life coach if you need that, to guide you with your schedules and to guide you in, adapting to the new environment that you're in. We also have free English classes. So if you feel that you need to improve your English communication skills, you can attend those. Now, we also have accommodation assistance. Actually, this is the least of your problems, but we do have partner homestays where you can find, families hosting your stay. Basically, it can be a Canadian family, it can be a Filipino family, but they're opening their doors, and they will have an available room for you to rent out, basically. Okay, so if you need that assistance, we do have that link in our website, and also we can connect you to our network, which has available accommodation. Now, next, we have career services. Another important service that you will be enjoying is the assistance when it comes to your work. So a lot of students ask us, do you assist with part-time work? Yes, we do. Do you assist with work after the completion of the program? Yes, we do. So career services will be there to assist you with your resume building, cover letters, interview sessions, and then you will be given instructions on how you can get employment. In fact, some of our employer partners are available to offer conditional job offers. So we'll get into that later on. Our programs have co-op, practicum, and job placement support. So when we say co-op, that's cooperative work experience. It's part of your curriculum. It's like internship, right? But our co-op, the advantage of it is that, number one, you don't need to look for your own co-op employer, because we already have the employers set. So we're just going to do a job placement for you. Also, our co-ops are paid. So you will be maximizing your earning potential while you're studying. Last but not the least, we have immigration consultation support. So we have immigration consultant partners, and we have education agent partners as well, just like Roman and Associates. We partner with only the legitimate ones. So if you need to speak with any of the Roman and Associates team when you're already there in Canada, then just let us know and we'll schedule that appointment with you. Now let's talk about the healthcare assistant diploma. So this is a program, okay? We'll delve into this program. But first, let me play this video for you. And these are our graduates, actually. I hope that you learned something from this video, from their experiences. Just 1 second, let me play it.
I have nothing but respect for the healthcare assistants, because if it weren't for the healthcare assistants, the nurses don't know the patients or the residents the way that the healthcare assistants do. They are the first line of defense, if you will. They come to you and they know when your patient is having any kind of a bad day or a good day. They know them way better than I do as a nurse. And so I 100% depend on the healthcare assistants to come to me with whatever needs to be done for that patient. What I first noted about Stenberg College right away when I started here was that there are so many resources available to the students, and the faculty and the school itself really cares about the success of Stenberg College students. What particularly impresses me about the HCA program here is the in-depth and breadth of knowledge and curriculum that is taught. It's not only just the provincial curriculum that's being taught, but it goes further so that the healthcare assistants can understand the diagnosis, not just what to do when this person has this. If they fully understand it, then they're going to do better in their career.
Our HCA program, I feel, is one of the best because of the simulations lab, the nursing lab, the way that they have integrated the nursing instructors to be able to have them in the same classroom, sometimes in the same lab as nursing students. So they have that cross-pollination of information with each other.
I get really excited when I teach, and I'm sure some of my students, if asked, would say this about me. I'm not just talking about diabetes, for example. I get involved in the background of it and then how to care for said person with diabetes. And so what I hope to pass on to my students is to get excited about it and not just treat it as just a job. It's not just a job that pays the bills. You're helping people, you understand, you do this, and this is the rationale for it. And to be able to help people, and not only the patients, but their family and their extended family and the colleagues that you work with, I think it's really exciting for me, both on the floor, nursing, and to instill that into my students. What I like my students to take away from the classroom, not only into their clinical, but into their careers, is the ability to believe in themselves and that they really are making a difference.
Growing old is inevitable, I suppose, and from my point of view, I just do the best I can for myself and for other people. I really think that here the staff are wonderful, and I'm just thankful that I'm in a place like this.
Before the HCA program, I was a housewife and I have regular jobs, but not a career.
Coming to Canada, I have like big dreams. For a starting point, it is very hard. I got like little bit confident. Okay, I can work in a gas station, and I started working there. But going and coming back, it's the same routine, and then it's just stuck. The life is stuck.
My life before this, I was a digital designer. It was just hard to deal with contract jobs and not knowing whether if I'm able to support my son next week.
When I first started, all over it was a good experience, but I did have some obstacles. With the extra help from Stenberg staff, I pulled through with success.
We work together. If there is any kind of problem, personal problem, or about the education, so we work together, and so that everybody is fine.
We were given all the tools and all the skills that we needed to have in the real world.
Now, I got more confidence that I can do better.
All the comments I got from my preceptor, they said it did not feel like they're working with a student. It felt like they are working with another HCA.
Aide called me one day to come for an interview. And then I got the job.
I have a stable job where I have income coming in, which I love doing. And then with that, I can also invest into my hobbies, which is design now.
I love working with elderly people. I love making a change, giving my minute or two and talk to them, make a difference in their life.
Having this job is perfect for me.
I remember one time I did go back, even though I was already off clock. I went back and went to see one of the residents. And just seeing their faces react to you, even coming back to them to talk to them, it's just rewarding. Not only it feels right, but it just, you're happy, knowing that you're making other people happy. I have a feeling that eventually people are going to realize this is a good, perfect career choice.
I have nothing.
Okay, now let's talk about the details of the program. So our healthcare assistant diploma is a fully recognized program by the BC Care Aide Registry. It is an essential work and it has a very high employment demand. Our program has a paid co-op, job placement support, and we will also be assisting you after you complete the program to get yourself registered at the BC Care Aide Registry. Now, last but not the least, we have a 100% employment rate at Stenberg College for the HCA graduates. So if you want to enroll into this program, there are actually two variations of the program. The first one will include a 3-month English studies. So when you do this, the duration of the program will be 1.3 years and it will have 6 months of paid co-op. Now we can accept as low as 5.5 overall score for your IELTS, whether it's general or academic. So this is the required IELTS score. Now, if you do not require an English studies component, or you have met a higher English proficiency result, then you can just go for an 8.5-month duration with a 2.5-month paid co-op. So as you can see, I've already included the total tuition fee for each of the programs, and they're very affordable. Now, the tuition fee that we have already includes registration fee, assessment fee, the co-op fees, your material usage, and your books. Even your first 3 months of medical coverage is already covered in that tuition fee. Now, when you make an initial deposit, you don't actually need to pay the whole thing immediately. You can just pay an initial deposit of 5,150, and then the rest of your balance is paid per installment when you're already in Canada. So a lot of you might ask, oh, you don't waive IELTS, why do you need IELTS? Actually, even if you go to other schools that waive IELTS, you will not be registered as an HCA. Why? Because the BC Care Aide Registry requires an English proficiency result coming from those who are, from non-English speaking countries. So we are English speaking, but that's not our national language. So you will still be required to provide an English proficiency test. So as I believe, it's not just IELTS that's accepted, CLBPT is also accepted, TOEFL IBT is also accepted. Here in the Philippines, the most accessible and most common English proficiency test that is being done is the IELTS. And you can even take general or academic. So again, it's not just the school's requirement, but it is the healthcare assistant BC registry that requires it. So who qualifies for the program? Because I was not able to put it in the slide. Who qualifies for the program? If you are a K-12 graduate, you can already enter this program. If you are a bachelor degree holder, you can also enter the program. Now, if you're an undergraduate coming from, the old Filipino curriculum, as long as you have completed second year of college, you will be accepted. So do we have any bursaries or discounts for this program? Yes, we do for this year only. So it's not late yet. We still have the October intake, which is the fall intake. If you join that, we will reimburse your IELTS cost. So if you take your IELTS and you complete everything, we will deduct, 350 Canadian dollars into your tuition. Also, for this year only, for the October intake, we will waive your application and registration fee worth $400. So in total, you'll be saving up to $750 when you enroll this year only, 2022 intake. So what's the highlight of this program? We have a conditional job offer available from one of our partner employers, Retirement Concepts. We have 100% of employment rate for this program, and you will be assisted to be registered at the BC Care Aide Registry. Okay, so let's talk about just a quick discussion on the immigration pathways. I mentioned in the beginning, we are a private institution. It means that you will not be eligible for a PGWP. Okay, there is no PGWP. Why? We don't actually need this for this program. So we're a private institution. And in replacement of, well, just to clarify, the PGWP is there for you to have a valid visa so that most students, what they do under PGWP is they look for their own work sponsor, right? In this particular program, you don't actually need that because you already have a work sponsor available. So there's no need for you to undergo a PGWP. You can actually go direct to a working visa. It can be under an LMIA, right? It can be under a temporary work visa leading to a long-term work sponsorship. So it really depends on the type of employer that you'll be accepting or the type of job offer you'll be accepting. But there is no need for our students to undergo PGWP. Once you accept your work offer, you will be eligible to still apply for certain immigration pathways. And now this depends on your, the rest of your profile. So I mentioned retirement concepts in the beginning, just a few earlier slides, and they are one of our partner employers. Now, the good news is that we were able to collaborate into providing our students with conditional job offers. This means that while you're studying with us, you can actually work for them on a part-time basis. They can also be your co-op employer, and then it will still lead to a full-time work sponsorship after you complete our program and registered as an HCA. So I wanted to meet the HR personnel at this particular employer. We did a short video, sort of an interview, so please excuse me in this video, but I hope you learned something from them. Let me play this video for you. Hello, everyone. My name is Jenica Licerio, and I'm the Director of International Admissions and Recruitment for Southeast Asia. We are here with Sabrina Price, and she is from Retirement Concepts. So, hi, Sabrina. How are you doing?
Hello, I'm good. How are you? Hello, everybody.
Hello, thank you. All right, so let's get started. I'm just going to ask you a few questions about our partnership, Stenberg College and Retirement Concept Partnership. So first of all, can you please introduce Retirement Concepts to us?
Yeah, no problem. So Retirement Concepts, we are one of the biggest private-owned senior home companies in British Columbia. So we have 23 homes. 20 of those are in British Columbia. One is in Alberta and one is in Quebec. So we are a very big facility. We have over 6,000 people now that work for our organization. And we are happy to have new people come and join us.
Awesome. So for this year, we have collaborated and we are going to provide our students conditional job offers. We're going to provide them part-time work while they're studying, and eventually will lead to a full-time job offer after they complete their program. So can you tell us more about that partnership?
Yeah, so we're really excited about being able to offer everyone positions while you're going through school. So starting off, if you're in school, it's going to be hard to work full time. So you'll have the opportunity to work as a support services worker, which would fall under the categories of, say, a housekeeper, laundry aide, or server, or janitor. And then once you are going through your schooling and you've completed, say, your HCA course, we'd be able to offer you an HCA position. Same thing if you were to complete your LPN course, we'd be able to offer you an LPN job, RN course, RN job. So throughout the journey with Stenberg, you'll be able to work with Retirement Concepts on that same journey with various roles.
All right, and where are the possible locations our students will be working in?
Yeah, so we have the lovely locations on the island. Reference point would be Victoria, British Columbia. We have many homes. We have 7 homes here on the island. So I actually live on the island. I love it. It's a great place to be. Our other locations that we're able to offer these conditional job offers would be in the interior of British Columbia. Another reference point for anyone to check it out would be Kamloops, as well as Summerland and Williams Lake. So the interior is also beautiful, many lakes and nature. It's lovely.
All right, that's good. That's good to hear. Now, our students would like to know as well, especially because some of them, they may be hired as a part-time worker, or maybe when they're already working full-time. And these are different positions, as mentioned. They can be working as a support, they can be working as an LPN, RN. So maybe you can give us an idea of the salary rates for each position. I know that it will change eventually when, when they start working. But right now, can you give us an idea of the salary rates?
Yeah, I can give you an approximate. Again, all of our homes are what we call unionized, so they're all a little bit different. So these numbers I'm giving are approximate. But say for a support services worker, so a housekeeper, laundry, or a server, right now the wages are around $20 per hour, approximately, give or take a few dollars on either side. And then a healthcare aide right now is approximately $25 to $27 per hour. LPN is around the $32 to say $36 per hour, and an RN is anywhere upwards of $40+ an hour.
Thank you for that. Now, because our students are also studying, right? And we would like them to have some sort of security that they can work at Retirement Concepts after they complete their program. So can you tell us about the conditional job offer that we will be providing the students?
Absolutely. So once you guys go through with Stenberg and you make your commitment to going with Stenberg, we'll then be able to work directly with them to have interviews with all of you. And then at that point, if we feel it is a right fit for both parties, then we'll be able to offer you a conditional job offer before you even come to Canada, which is lovely. So that gives you, one, a peace of mind that you have an employer ready to go for when you get here. It also allows us and the excitement of knowing that you're coming to join our team. So the conditional job offer, I would say, is very exciting for all of us.
Yes.
Yeah, we're very excited about it.
Exactly, yes. So as a last question, Sabrina, can you tell us what students can expect from Retirement Concepts as their new employer?
Yeah, so for us, we are very big on growth, service, integrity, and trust. That's our mission statement. So that's not just for corporate employees or for managers. That's for everyone. We want to make sure that people who are joining Retirement Concepts are really there for our residents, because at the end of the day, without the residents, we wouldn't be here. So making sure that every day you're trying to make the seniors' lives as good as possible, that's what we're looking for. We're looking for someone who's compassionate and excited about the opportunity to make a difference in these seniors' lives. Retirement Concepts, as well as us being a private employer, it's a bit smaller than working for one of the big health authorities that could have upwards of 30,000 employees, where you're not as close with your coworkers, say, or your managers. At Retirement Concepts, we treat everyone like family, and I genuinely believe that. We treat everyone like a piece of a family. So that's what you can expect from Retirement Concepts.
All right, thank you so much, Sabrina. All of these are very exciting, not just for our students, also from Stenberg College. We're pretty excited about this new venture with you, and we are confident that our students will be very happy with, this partnership, and so they have something to expect when they arrive in Canada. So thank you so much for giving us your time today. I really appreciate that.
No problem. Thank you so much.
Bye, everyone. So there you have it. That is our presentation from Stenberg College. I hope that you learned something, and I hope that you now have clarity on the program that we're offering at Stenberg for healthcare assistants. So with that, thank you very much for listening. Back to you, Rose. Thank you. I believe this is the time now for the question and answer portion. So if you have any questions about the presentation
Okay.
or you want to clarify anything, I believe that you can type it in your Q&A box or in the chat box. Thank you.
Okay, guys, if you have questions or clarification, Ms. Jenica, may I please you can make me host again so I can proceed with my screen sharing. Thank you. Okay, so there you go. So to our participants, you have questions or clarifications, you may now ask them, or if you are hesitant to, to unmute yourself, you may probably post your question in our chat box, then we will be addressing them one by one. Okay. So Miss Jenica, there's one question in our chat box. This is from Sir Enrico. Okay. Hello, can you give us an idea how much the cost of living in British Columbia or Surrey? I was told that the income tax is slightly higher than other provinces or towns.
Okay, so I think this is something that I can only refer to what the government of Canada has stated. So in a year, okay, the computation and the living cost would be 10 to 12,000 Canadian dollars, right? So let's just say 12,000 Canadian dollars. So in a year, you are able to live by 1,000 Canadian dollars, and that includes, everything that you need. It really depends on how you spend or how you live. I guess that's how I would put it, because some students um can actually be might need a little more than that, probably because of the way that they live. Now some students might actually need less than that, right? So I think it would really depend on how you spend. Now when it comes to the taxes, Vancouver, I think, has a bit of a reputation that it has a higher cost of living. But if you actually check all of the aspects of your living conditions, you will see that it is almost just the same with living in any other, any other major cities in other provinces in Canada. So I think that's what I can say about that. Okay, but when it comes to income taxes and things like that, our students, we don't actually get this question a lot. I would ask you to check on the website, okay? But as per the Canadian government, 12,000 per year should be enough for you to be able to live. And when you're living in Surrey, you're actually living at a lower living cost if you compare it to Vancouver. You're near Vancouver, but because Surrey is a sub city, sort of, that's how I think. It's not. It's a sub city of Vancouver. There you go. So you actually have a lower cost of living. I hope I was able to give clarity on that.
Okay. Ms. Jenica, we have few questions posted in our Q&A chat box. And maybe probably go to the question coming from Miss Vicky Valio. How much po ang funds na need? I just want to clarify, Miss Vicky, you are asking for the whole funds needed for the whole program. Am I right? Including the immigration process and the school admission? Okay, sorry. For that one, Miss Vicky Value, for the total amount of funds needed for you to be able to, to accomplish the needed procedure, including the immigration process and the admission, you will be needing around 1 million pesos, wherein 200 pesos would go to the immigration process itself. Then the remaining would be part of your proof of fund, together with the balance of your tuition fee with Stenberg. So that's how we estimate the funds that you need to prepare for you to be able to process your working visa and, of course, successfully admitted to your specific course with Stenberg College. You want something to add, Miss Jenica, about the question?
I think you were able to cover
Okay, thank you.
information on that.
Okay, I hope Miss Vicky Value, I was able to answer your question. If you have you still have clarifications, please, you may also post them in our chat box. There is also question from Miss Sandy Versosa. For Indian national lang po ba ang installment?
Oh, no. I think what you saw from my slide is the initial deposit. It says 5,150. For Indian nationals, it's 10,000 Canadian dollars as the initial deposit. All of our tuition fees on all of our programs, the students are actually allowed to do installment payment plans. So if you pay 5,150, the rest of the balance is paid per installment through like a monthly or a quarterly payment. So lahat yan for Filipinos also.
Okay, thank you, Miss Jenica. And another question is from our anonymous attendee. Good evening, ma'am. Do you accept certificate from our college school, which is certificate of English as medium of learning instruction? Because some schools accept it in lieu of IELTS.
Okay, so this has always been a question, and what you need to understand when you're working in a medical sector is that you will need to go through an English test at some point, one way or another you will, because it's the requirement of the government. It's actually not a school. As a school, we follow what the government requires. Here's what I'm gonna do. I'm gonna share a document to you. I put it on the chat box. You can click on that. And what you will see is this is a document on the English language competency requirement for an HCA program. And this is applicable to all. Because I always share this because a lot of students think that it's just the school requiring the IELTS. Actually, hindi. English language proficiency test is required by the government.
Okay.
So, yung link na yan, it will show you the available or the options rather on what type of English test you can take. You can take CLBPT, you can take CELPIP, IELTS, KL, or TOEFL IPT. So, yan yung mga options ninyo. And there are also on the second page the countries wherein they're exempted from taking IELTS, okay, because English is their primary language. So unfortunately, Philippines is not part of it. What you guys normally get kapag nagwa-waive ng IELTS, pagdating doon or even before you arrive, pinagtataken ng IELTS or you will not be registered unless you have it. So that's what happens. So unfortunately, we've done this before, para lang ma-share ko rin lang sa lahat nun. We've done this before. We decided to waive the IELTS, hoping, because mataas ang proficiency supposedly ng Philippines, right? When it comes to English. Unfortunately, that's not the case. That's not the case anymore. Medyo bumaba ang proficiency ng mga Pilipino. Not all, but we've encountered a few students who were unable to meet the minimum requirement. And our minimum requirement is 5.5. That's really low. If you go to a public college, your requirement will be at 6.5. Normally, academic lang ang hinahanap. So our English requirement is quite reasonable. So 5.5 minimum, no band lower than 5.0. But if you want to be on a direct entry, 6.0 overall score, no band lower than 5.5. So we will no longer accept certificate of English as a medium of instruction kasi nagka-problema kami sa pag-waive sa mga students. Because when you get there, doon namin nalalaman na okay, hindi pala tayo proficient. So magkakaproblema lang po kayo sa visa ninyo kapag nangyari yon. So I would highly recommend to take your IELTS here in the Philippines habang nandito pa kayo. In fact, we will run an IELTS workshop sometime this June, probably by the 3rd or 4th week of June. We have a free English IELTS workshop. So in this 2-day workshop, we discuss ano yung mga tips on how to get higher grades, ano yung hinahanap na mga IELTS moderator, ano yung hinahanap nila when it comes to your exams. So I think that might help you if you're planning to take your IELTS. So just I'll send the invite to Roman and Associates team when we have the final dates, and you can join that. It's for free. I hope that clarifies the IELTS kasi parati tong tinatanong talaga sa akin, asking to be waived. Unfortunately, we cannot do that because it's not just the school but the Basic Year Aid Registry requirement. Thank you.
Thank you, Miss Janica. I just want to add something from what you've answered from the question of our anonymous attendee for this one. And if you're worrying about this, the assistance and how you will be able to facilitate, enroll, and register for your IELTS, don't worry, because one of our employee from Roman Canadian Immigration Services, we will be delegating, of course, our case processing manager, who will be assisting you all the way with your IELTS from the registration, orientation, down to your review until you finally take the exam. So we will be giving you the full assistance you need to, as you attend to your IELTS requirement, and definitely we will be ensuring that we'll give a quality assistance until you successfully get the required score for this one. So I hope we answer your question, one of our attendees. And we still have like 2 questions more, Miss Jenica, from Sir Dave Stephen Tejada. Same question with our with Miss Vicky Valio. How much is the overall cost, and what if you fail the program? So
Okay.
I believe I already answered the first question, ma'am. So
yes.
please clarify on the second one. Thank you.
Yes. So when you start the program, you will actually have up to 3 re-entries kapag talagang nafe-fail ninyo. So meron pa rin kayong chance to actually re-enter the program. Now, even before you fail, okay, before kayo mag-fail, actually wala pa naman ako na-encounter na talagang nag-fail sa HCA. But if that happens, okay, you will actually be given a lot of support kapag nakikita kasi ng instructor that you are struggling, let's say, with a particular course. When we talk about course, I mean subjects, okay? In Canada, we refer to subjects as courses. So when there is a particular course that you're having trouble with, the instructor will already intervene. If there are additional mga one-on-one sessions that you require for you to understand the course, or meron kang nakikita nila na medyo struggling ka doon, they will the student services and the instructors will already intervene there. So I highly doubt na after ilang intervenes ay mag fail ka pa. Kapag nag-fail ka, it's really you with your attendance. Mostly ganyan kasi na-focus masyado sa trabaho. So it's the attendance, or talagang hindi ka nag-aral. And which is why we really have the academic support for the students. Kasi we don't want you thinking na just because you're under a student visa that you can take it for granted, because it's really important. Your program is all about caring for others, caring for people who cannot care for themselves anymore. So hindi pwedeng okay lang grades, di ba? Kasi practical and theoretical component yan magkasama when it comes to HCA diploma. So the instructor and the student services will definitely be assisting you. Meron tayong mga life coaches kapag nagtatrabaho kayo and you're having trouble with your schedule and all of that, ina-assist kayo ng life coaches. And from the feedback of our students, it has been really helpful for them nung nagkaroon sila ng life coach, especially sa mga first few months of their program wherein they start working and then they are also studying. So if in the event na after lahat ng intervention na fail ka pa rin, you will have a chance for a re-entry. A re-entry is aalaw ka pa rin na ulitin yung program or ulitin yung mga kailangan mong ulitin in order for you to pass the program. Okay? In the event na let's say talagang hindi mo talaga siya mapasa, there is another option for you which is a program change. Kasi nandun ka na sa Canada pauwiin ka pa ba namin, diba? So marami ka pa ring option. Magkakaroon ka ng option for a program change. I do not recommend it. However, it is, an option for a last resort para you still get to stay in Canada. And if you still fail that, sabihin ko sa'yo na mukhang may problem ka with the way that, you're dealing with your studies. Kasi important pa rin po na mag-aral kahit nag-work. Okay? So I would say, mag-aral po tayo dun sa time na dapat nating mag-aral. Okay? So that's it po. At least you have a lot of options, right? If you're struggling with the program.
Thank you, Ms. Jenica. Ms. Vicky Value has a follow-up question about the tuition fee. And may I request Ms. Jenica to please, reiterate once again what is the tuition fee for the healthcare assistant program, so everyone will get, everyone can remember. But pretty sure as soon as I receive your CV, we will be sending you our eligibility check email. Then from there, you'll see how much is the actual or the tuition fee for the specific course. But we'll have Ms. Jenica mention the tuition fee again, so everyone will be everyone can hear, and the specific the fact will be remembered by everybody. How much is the tuition fee for the course, ma'am?
So for the HCA diploma that has a 3-month English studies component, so it's a duration of 1.3 years, the total tuition fee would be at an estimated 17,032. Now, that 17,032, mababawasan pa yan if this school year kayo papasok. So that means na you can save up to $750 out of that. Okay, so 732, and then the initial deposit is 5,150. Now, if you happen to meet the requirement for a direct entry, that means na wala na kayong English studies component, the total tuition fee is just 14,900 approximate. So 14,900 approximate, and then you will just pay an initial deposit of 5,150. So the rest of the balance paid per installment na siya.
Okay, thank you for a clarification, Ms. Jenica. And we also have like two more questions in our Q&A chat box. So again, from our one of the attendees. Good evening. If a registered nurse already in the Philippines, do we need to take the whole HCA course? Same with other non-medical students. Thank you.
Okay. I think what Filipinos need to understand, I'm not saying na hindi natin naiintindihan, okay, but medyo iba kasi yung tingin natin when it comes to diplomas. Madalas natin naiisip baka may mga course credit dyan. Iba po ang setup ng diploma certificate programs and postgraduate diploma programs in Canada. It's even in other countries, no? It's always a combination of a theoretical and practical skills. And it does not even require a student to be a nurse for you to enter it. So it means na lahat na ng kailangan na knowledge and practical skills of an HCA is nandoon na siya nakapaloob sa program na yon. Now, regardless whether you're a registered nurse, a non-registered nurse, or non-nurse, okay, you have to take the whole HCA program. So hindi siya based sa background mo, whether you're a medical student or a non-medical student. Any student who will enter, regardless of their background, will have to take the whole course. There's no course crediting. Nangyayari lang po yung course crediting when it comes to bachelor degrees. Okay, if you plan to do bachelor degrees and let's say same yung bachelor degree ninyo, yan, possible yan mangyari. And that's in universities. Pero if you're taking a diploma or certificate or postgrad diploma in any other colleges, hindi po yun nako-course credit based on your background. Okay? Kasi actually, natanong na sa akin to before multiple times. Now, if you're a registered nurse, and meron ka namang work experience, I would say take the postgraduate diploma in Canadian nursing. Kasi yun talaga yung pathway for you to become a registered nurse in Canada. You can be a licensed practical nurse or a registered nurse at the end of the program, and you will also have an HCA qualification within that program. So sa mga registered nurses na nakikinig, if you're an RN, you have work experience na, take the postgraduate diploma in Canadian nursing. And that is a discussion actually on a different webinar, no? Because HCA basically is for those who are coming from, let's say, non-nursing background, o kaya naman BSN graduate sila pero hindi sila nagtuloy as a registered nurse. O kaya naman meron silang caregiver background. So the HCA would be your best pathway to enter Canada and to be part of the medical industry. So there you have it. Thank you.
Thank you, Ms. Jenica. We have a few more questions in our chat box, and I just love the participation that we are receiving from our audience tonight, and I hope our other webinars will be as active as this one. Okay, so there you go. Let's proceed to other. Okay, attendee who has questions. Okay, as a student permit with this program, can we bring our spouse and dependents? Okay, so probably I may be taking this question and I want to answer this one for the benefit of everybody. First, student permit or study student visa, you are eligible to bring your spouse or dependents with you, but we want to make it clear that for every visa application there's always a risk of not having your visa approved. So for this one, yes, pwede nyo pong isama yung asawa or yung mga anak nyo, but at certain cost. So there are some documents na on top of the principal applicant na kailangan ho nating i-secure para sa asawa or anak na isasama. Of course, with other fees, meron din ho tayong additional should you want to really bring your spouse and dependents with you. But on the side of us, like an organization who's offering like consultation services, we do not really encourage you yet to bring your family, to bring your spouse or dependents with you, because like what Miss Jenica said, since the student pathway or the HCA program requires really your focus to make sure that you will successfully finish the course. I suggest at the end of the program, should you land to a job, that's the perfect time for you to bring your spouse and dependents with you. But again, if you will insist, yes, you can bring, but we cannot really guarantee that your visa will get approved by means of that, intention of bringing your spouse with you. And of course, on the part of the proof of fund, since what we are really aiming here is to really prove to the immigration officer that you are capable of sustaining your stay to Canada with your spouse and dependent with you. There will be an increase also in the amount that we are to require from you in your POF or proof of fund requirements. So those are the cases possible should you want to consider bringing your spouse and dependent with you to going to Canada. So I hope I answered your question. And if you do have follow-up question, please feel free to type them again in our chat box. Ms. Jenica, let's proceed to other question. Aside from our paid co-op, are we also allowed to have part-time job from other establishments or workplace?
Okay, so I want to answer this. Yes, when you are under a student visa, you are allowed to work part-time 20 hours per week, right? During school breaks and school holidays, you're allowed to work full-time. Now, when you're doing your co-op, you will have 20 hours per week of co-op. And then you will also have the opportunity to use the 20 hours coming from your student permit. So basically, during co-op, you'll be working, you can work up to 40 hours per week. Now, what I would say is, if you're already working with one particular employer, baka gusto mong dun ka na rin mag-co-op or dun ka na rin mag-part-time kesa nagta-travel-travel ka. But it really depends sa'yo. If you feel na mas okay na dalawang magkaibang employer siya. But like for example, if you happen to have work at Retirement Concepts for a part-time work, it's possible that they can also be your co-op employer, so that you'll just be working in one establishment up to 40 hours during the co-op time. Pero kung magkaiba, okay rin lang. It's allowed.
Okay, thank you, Miss Jenica, for answering that question. We also have additional question from Mr. Dave Stephen. Aside from the tuition fees, what are the other expenses? So I think this question primarily asked about the immigration process and the fees necessary for us to proceed with your application. Sir Dave, aside from the tuition tuition fee of course the course, there are multiple fees which you need to settle. But what's good about Vermont Canadian Immigration Services is that we are not really billing our client one time. So we will just be sending you notification and a request, or of course an invoice, when you need to pay a specific fee, depending on what specific stage are we in your application. So as you decided to pursue with the program, let's say for example you are eligible, then we had your CV assessed, then you decided to pursue and enroll. First fee that you need to pay to us is the administration fee. So that is 1,400 Canadian dollar. Then after that, we will be of course assisting you with your IELTS. And initially you will be shouldering the IELTS, and like what Miss Jenica said, this is reimbursable to be deducted in your tuition fee balance. Then we also, of course, we also have, since we are being guided by a licensed immigration consultant, of course we will be asked to pay the retainer's fee for this one, which is 1,500 Canadian dollar. Then our government fees, we have the visa application fee, medical exam, biometrics. Then those are the minimal fees that we need to be prepared of as we process your immigration process. So on the third stage, of course, you will be asked to pay the tuition fee balance in the amortized scheme as mentioned by Ms. Jenica as soon as you get into Canada. But of course, we will be needing, of course, also your proof of fund. So this is where a specific amount is to be required out of your financial document, and this will support the claim that you are capable of sustaining your stay to Canada. So these are your like bank statements, certificate of deposits, proof of assets. So this will give you the confidence of having your visa approved and finally convince the immigration officer to grant you the necessary visa to Canada. So those are the fees. And don't you worry, as soon as I receive your CV, sir, we will be sending you our eligibility check email wherein you will be seeing a specific table there. So we will be indicating there the specific fee together with how much it costs in Philippine peso or in Canadian dollars. So we will also proceed to the program discussion as soon as you receive that specific email from us. Okay, I hope, Sir Dave, I was able to answer your question. And next, we have another question here from our one of our attendees, I just finished second year college level undergraduate. Am I qualified?
Okay, so as long as you have already completed the full second year college, you will be qualified, because what we're looking for as a minimum on academic background is year 12 equivalency. Okay, so meron kasi minsan nagbibigay sa amin na second year college and then hindi pala complete, ganyan. As long as you've completed it, then that should be fine.
Miss Jenica, can I add something po dun sa previous question na sinagot mo, ma'am, about dun sa
Yes.
eligibility nila? If ever that you are undergraduate and you finish second year college, for that one, we can probably verify or submit first a document for validation before proceeding to the necessary steps. So at least from by doing the initial assessment, or we can probably manage your expectations should you know to know if you are really qualified or not. Beside, we of course we have our team to assist you and give you the idea if you are qualified or not, or eligible or not to a specific program. And then we will be proceeding to a product discussion for you to uh, to understand how it will be should you decide to pursue with a specific program like healthcare assistant program to Canada. So okay, so there you go. I hope we answered your question. From Miss Leilani Omaweng, how much is the tuition fee for postgrad?
Okay, Leilani, I think it's best for you to submit your resume first to Raman and Associates, because if you're referring to the postgrad diploma in Canadian nursing, that's a whole lot of different information that we need to share with you. So I think the best way to do here is to submit your resume first. And then let's see whether you qualify for the postgraduate diploma in Canadian nursing. We normally provide all of the information naman once you qualify. So all the tuition fee, all the requirements, I think that's the best way to address that.
Okay. So, Merlin, there is another question from our Q&A chat box from Miss Sandy, again, Versosa. How much naman po yung babayaran sa agency? I believe this was the same, this question was, is the same to the one being asked by Sir Dave. And again, ma'am, so as soon as we receive your CV, we will be sending you an eligibility check email wherein there's a specific table of fees indicated on that specific email. Then there you'll see the specific documents or the certain fees which you need to settle as soon as you decide to avail our services and of course go on with your program. Okay. I just want to say something dito lang sa message ni Miss Sandy. Sayang yung IELTS ko expired na. No worries, Miss Sandy. Of course, you again, yung validity po ng IELTS natin is only good for 2 years. And if expired na ho yan, we can still, take another one. And since it's it is a mandatory requirement for you to proceed with healthcare assistant program, we will have our team to assist you from the registration, orientation, review down to the examination proper. Okay. One more question, Miss Jenica. How about the cost of accommodations from our anonymous attendee?
Okay, so it really depends again on what type of accommodation that you're choosing, but it can range from as low as 350 Canadian dollars on a monthly to up, let's say, 1,000. Malaki yung range, right? Now, if you're looking for, let's say, a shared accommodation, shared kayo ng bathroom, shared kitchen, ganyan, but you have your individual rooms, it's possible that it would be around 500 Canadian dollars. It will already include all of the utilities, okay? Now, if you're someone naman that you want your own studio type, nag-iisa ka, tapos nasa, let's say it's a condo type, it can be as much as around $800, $900 per month. So it still depends. Okay, so most of my students kasi they share accommodation. It ranges, pag may pamilya, hindi ka talaga pwedeng mag-share. Okay, isa to sa mga mahal. when you bring your family over or your children over, you will have trouble finding an accommodation that you're sharing. You probably will have to rent on your own, which again will cost you more. Um, ang cheap na nun kung makakita ka ng 800. So normally mag $1,000 talaga yan kapag may kasama ka. Now, if you're sharing accommodation, some of my students nasa 350, 400, ganyan. So it can be low lang naman.
Okay. Thank you, Miss Jenica. And we still have one question from Miss Irene Martin. How about, ma'am, if I have sister there to accommodate me? Would it be okay? Yes, definitely,
Yes,
Miss
yes.
Irene. Yes, it will be okay, and that's best for you. At least, it will be, no longer part of your expense within the whole duration of your stay in Canada. So as long as your sister can accommodate you, then it would be the best idea for you. So that would be fine. And okay, so I can't see any more questions in our chat boxes, Q&A in our personal chat box. Okay, so I think that would be all for tonight, Miss Jenica. I just
Yes.
want to thank our attendees for tonight for actively, participating. And wait, may humabol pa ma. Okay, so ay lang, kay Miss Irene Martin lang. Okay, you're welcome, Miss Irene. Then thank you, thank you. I'll just wait for your resume. Then just wait for our email as we assess your eligibility. Okay, so again, to our attendees for tonight, flashed on your screen is our email address where you can send your CV for free assessment. Don't forget to use the subject line assessment for HCA at Stenberg College. Okay, so I think that will be all for tonight. That ends our live webinar for Healthcare Assistant Program to Canada. Again, to Ms. Jenica, thank you for your usual assistance as we discuss and present to our prospect clients the program of your school. And I'm looking forward to be with you again on our next session for another program discussion.
Thank you. Thank you very much. And thank you to everyone who attended tonight. I hope you learned something tonight, and we will definitely help you with your journey to Canada. Thank you, everyone.
Thank you.